We did attempt to do this on Monday. We had every other tech challenge under the sun that you could imagine. And all we wanted to do was talk to Elizabeth Winston about our mental health and some different things that we could do during this time that might be helpful during this health crisis. So we're going to get to that in just a minute, but I do have to intro a couple things. Again, my name is Jason Hafman. I'm one of the board members for Dane Buy Local, also on the Education Committee and the Outreach Committee. And really during this time, we wanted to use this opportunity to talk to different members, different people that we have connections with, to examine how this current health situation and everything that's happening to us with it is impacting our lives from a lot of different angles. The other thing I have to remind you of is to subscribe on YouTube. If you get a chance, head over there and look up Dane Buy Local Community. Check out that new channel, subscribe. You can also post comments here on Facebook as well, because we appreciate that. And we're happy to have Madison Essentials as a co-host of the event today, along with Dane Buy Local, here for our first live Facebook interview of these. The other thing is there might be some opinions given today. If they are, they're either my opinion or Elizabeth's opinion, not necessarily representative of Dane Buy Local. So all of that stuff out of the way, I welcome Elizabeth in. Elizabeth, thank you so much for taking time for us on a Friday.
My pleasure. Thanks for inviting me.
So we, really want to talk about, in this scenario, like I've told you, we've talked to different people from a lot of different perspectives so far. But I feel mental health is probably one of the biggest adjustments, strains, factors right now for so many people under the situation. What kind of things have you seen out there for people?
Yeah, well, I think a lot of us are experiencing anxiety. So anxiety is when we feel nervous or tense or on edge a lot of the time. And of course, that describes how probably all of us have been feeling during this unprecedented and unpredictable time. So when we experience a lot of anxiety, we can go into a fight or flight or freeze response. So the same kind of response that you have when you're in physical danger can also happen when you're feeling psychological danger. And you may have an urge to fight or run away or freeze and just kind of check out. So I'm seeing a lot of those responses.
What other mental challenges are you seeing for people during this time? Because we've got obviously there's so many emotions. I mean, the range of emotions with such an abrupt change to our lives, and then so many new ways to do things can be such a stressor for people. But tell us a little bit more about some of the things you're seeing there.
Yeah, right. Good point. So, I mean, one of the signs I'm noticing in a lot of people is what I've been describing as cognitive overload. So there are so many things to think about and process quickly, and we have to make a lot of decisions and use our best judgment. And so that's just really an overload for our brain in terms of being able to think about and process things well. And so I think we're all compromised that way. Our judgment might not be as good. Our decision-making skills might not be as good. And I find that even something that used to be simple, of course, like going grocery shopping, ends up leading to cognitive overload because I'm thinking about staying safe and sanitary and trying to keep track of all the items I need because I can't run back the next day if I forget something. And so I think it's just really hard to think clearly and remember things like we do under more normal circumstances.
Yeah, I will say, the grocery shopping experience, picking up food for takeout, things like that is just... it's a strange experience, even still. But I mean, the first time or two that you go through that, it's been a really big shock and change for a lot of people.
It is. It's hard, when you're in public and you're just seeing people in masks, then it's very hard to read people. And that sense of community and connection that we often feel when we're out is lost. I mean, I just find it's very hard to even look people in the eye, or, you can't see people's mouths, so you don't know if they're smiling or frowning. There's a real disconnect there, and it's a big loss.
I do try to smile through my mask, but I don't know if everybody sees it or if they fully get it. I guess maybe that's where our eyes, sometimes you can have a big enough smile that you smile with your eyes a bit. So hopefully people are at least...
Hopefully people can tell. Maybe we should draw smiles on our masks. That might help.
That's a great idea. Actually, if you're out there and looking to make some money right now or find a way to help out and make money at the same time, create some fun masks like that that have smiles on them or something, and I'm sure you'd get people to purchase those at this point, because we all need a little bit more of that in our lives.
Yes.
Another thing I want to talk to you about was just this social distancing in public. First off, if we're outside, there are not a lot of public establishments people can go to at this point, but even trying to be aware of that, what has that done to people? Walk us through the kind of the mental process of that. Okay, you're going somewhere and then you see someone approaching you. A lot of us have fear. A lot of us have anxiety. We're wondering, is that person going to be socially distant? Are they going to recognize this and respect? I feel all of those things almost every time I walk past someone.
Yeah, I think the way you describe that is really accurate, and it's what I've heard people describing. So I think, this requires us to trust strangers. Like the situation you're describing, we're hopeful and we're having to trust that other people will be observing the same degree of social distancing that we're observing. But we all have different ideas about what that looks like. We probably even have different ideas about what 6 feet is, although that's an objective measure. So a lot of people are having big reactions is what I'm noticing. If we're already in that anxious or even fight, flight, or freeze mode when we're outside, then we're much more likely to get even more heightened. And I've seen people having angry responses when they're, and maybe that's that fight part of fight or flight. Some people just go home and give up on being outside, and that's the flight part. So, I think, people are already feeling in a heightened state, and so it can be tricky to navigate that distancing. On the other hand, I've seen people, mostly in parks and sort of beautiful natural settings, less so on bike paths, which seem to be quite crowded. So in more natural, peaceful settings, I've seen people enjoying each other's company with their immediate family and trying to be polite and graceful during this difficult time.
What about the people that have either taken ill, ended up in isolation, quarantine, can't have anyone around them during this battle with such a vicious virus? What does that do to a person in that situation?
Right. So, for those who are isolated under the circumstances you described, like being sick or needing to quarantine all by themselves, or even just for those who live alone and who have been alone in their homes for many weeks, it can be quite disconnecting. And so for those who have technology, they're using technology like we are today in order to stay connected, but it is not the same, of course, as actual physical touch. So being deprived of physical touch can be really stressful and sad. And just not being able to, say, have a meal with someone in person is really a loss. So again, I'm noticing it over and over that we're just all experiencing a lot of loss. And whether it's loss of physical touch or connection with others, we've lost our routines. We've lost important life events like birthdays and graduations, prom, sporting events. There's a lot of loss. And so another psychological phenomenon that I'm noticing is grief, because grief comes with loss. And so we're sad and we feel kind of empty. And a lot of us might be reminded of other losses we've had in our lives.
I want to come back to a couple things you just said there, but I thought you made such a great point. It is something I've thought about because, I work for Project Home, and we do a lot of work for elderly people, and we go into their homes to do repairs and things like that. And you see a lot of them living alone, and you can see what that isolation can do to people in just a general time or a normal time.
Yes.
But under these circumstances, I just can't imagine how much more difficult that can be for those folks.
Right. So that's something we're noticing nationwide, is that those vulnerabilities in our societal structure are exacerbated right now. So any problems that existed before seem to be worse now.
The one thing, and I'll share this, is we had, when things first started really getting serious with the situation, where people were really waking up to how dangerous this was, and hey, it's here, the governor's taking action, schools are are closing, things like that. We all had to. I live with a nurse, okay, so all right, she's on top of all of this stuff, and she understands what's happening and what are all the best practices. And actually, it didn't help that she used to be an OR nurse, because then she understands sterile technique, which she was trying to teach all of us sterile technique. So now, talk about learning new information and trying to think about every detail. I mean, if you've been in that situation in a surgery, and you have to think of everything you touch and every move you make and every place you put something, whether it's in a sterile place or a non-sterile place, it can be overwhelming. But I think one of the biggest strains for us when we first found that, and then we said, okay, we're going to be at home for a while, and we need to find out. People can be asymptomatic. These symptoms maybe don't show up for a while. We didn't hug our kids. We were afraid. Our kids were afraid to be close with us for a while. It was just, we tried to, but it's just not the same. And for me, and then I imagine for everyone that is used to that physical contact, even with your family members, eliminating that for a while, wow, that was really difficult.
Oh yeah, that's really painful. And that, I was thinking about attachment. That's the connection we have, our primary bonds with our closest family members, like parents, kids, siblings. And for those bonds to be stressed right now is another big stressor. So, those social bonds, that attachment, those are things that make us as humans more resilient. And so as we're losing some of that closeness, that makes us less resilient and more vulnerable. So it's so true, Jason, that the very nature of this pandemic, of this challenge right now, makes it harder for us to have some of the resiliency that we typically have when we're faced with major stressors like this.
Yeah, I feel just in general, I know all of us have our own internal strength, but a lot of us need, people to pick us up once in a while, and it's just more challenging to do that during this time.
Yes, we all, certainly can try to draw on our internal strength, and one of the ways to do that is to think about times in the past, some of the hardest times in your life, and think about how you got through those times, that you got through those times, and that can be reassuring. But we all need other people. That's just part of the human condition, that we thrive on relationships. And so the fact that this virus makes it much harder for us to have those relationships in the way that we usually have them makes it very difficult.
Yeah, I wanted to ask, have you seen an increase in people looking for help, mental assistance and mental health help during this time?
I think there has been an increase, and a lot of folks in Madison or in Dane County are trying to access mental health care through their HMO clinic, and the HMOs, that's the health maintenance organization. So like UW Health and Quartz, GHC, and so they're all at different points in terms of being ready to provide telehealth, so video health services. I'm in private practice at Sherwood Psychology, so I was able to be really nimble because I don't have a big hierarchy or insurance structure. So I was able to just roll out telehealth really in a matter of a morning. So I can provide that easily, but that insurance coverage doesn't cover private practice folks like me, although it covers some of them, but not me. So in that way, it's an expense, which of course is another stressor for people these days.
Yeah, I guess I was just curious to see if you were seeing more people reaching out, because I think it's so important during this time. We obviously, we're talking a lot about some of the challenges right now, and identifying those and examining those. And if you're watching this and you felt those same things, just realize, that most of us are feeling those things. But even though all those challenges are there are things that can be helpful, and sometimes reaching out to a professional can be one of the first steps there.
Absolutely. And if you've ever had contact with a mental health professional before, even if it was years ago, now is a great time to reach out and try to reconnect with them. Jason, I have had some folks, even from out of state, who've reconnected with me during this difficult time. So, yes, I think people are doing a lot of reaching out if they've had connections before. And I think this is a great example of why it might be important if you're on the fence about connecting with a mental health professional at any point. This is a great time to do it. And most of us are up and running through telehealth, and we can see you through the video just like this, or on the phone if that's your preference. And when things settle down a bit, whenever that is, it's a great time to connect with a mental health professional, hopefully even in person, and then you're connected.
Yeah, I think I think the ability to offer the services right now, through video, through telephone, things like that, is just really invaluable. Still being able to do it is huge. So I'm glad that you and so many of those professionals are able to do that and offer those services for people. Okay, I'm generally an optimistic person, so I'm going to talk a little bit about some silver linings here that I've experienced, and you tell me how maybe other people have been able to find things like this to help them get through this time. But one of the benefits of this particular situation is I've gotten to spend a lot more time with my family and with my kids, and we've had time to do things that otherwise, with the hustle and bustle of life and work and school and other activities, we wouldn't have the time to do. So that, at least, has been something that I'm taking away from this as a really big benefit.
Absolutely. A lot of people have said that they're really enjoying the time that they have with their family. So for those of us who are lucky enough to live with other people who we usually like, then it's been really fun to spend quality time together. I'm a parent too, and I'm really enjoying not running kids all over the place for different events, although some of those events have moved online. So then I'm just running around the house with computers and Zoom logins. But it's nice to just spend time at home and not have to be running all over the place. Other silver linings, similarly, some people I've talked to have said that they've realized that all of this travel and commuting that they're doing for work probably is not necessary. That's been a huge wake-up call, and I hope that has good long-term implications in terms of people being able to stay home more, be with their families and friends more, and their pets, and also to help with conservation and not making such a big impact on our environment with all of this travel for work. So hopefully people will stick with the use of technology when this is over.
Yeah, I will say that our 13-year-old dog, I think she preferred a nap more like she used to, but now there's everybody around making noise and moving around. She doesn't get those same naps that she used to during the regular situation. But I think you're so right. This situation, it pushed a lot of employers to make that possible, work from home possible, that maybe weren't doing it before or taking that step. And if they're seeing that this is working, man, think about what that could do for us as employees moving forward, to have more flexibility, to still be productive at our jobs, but also have a little more family time. I think that's fantastic, and save a little bit on gas and running back and forth and all that stuff.
Right. Yeah, I know some of my colleagues, my fellow psychologists, have said that they will definitely continue to do more teletherapy, that they really enjoy it. And I can see for myself that some of my clients might say, hey, I'm really busy at work today. I don't want to run over to your office. Let's just do a telepsych session, and we can do that.
Wow, I really enjoy, some of the things we're getting to experience. I had a friend that made a really interesting post. I think she shared it. She didn't create it, but here's an opinion part. Sorry. It just said that, I think with this, one of the things this has shown us is that half of us can work from home, and half of the workers need a raise. So the people that are out there right now, let's talk about their perspective, that are through this whole thing, have had to be in those cases. They work in a grocery store, they work in one of the essential services where they're having to interact with people and provide a service. What kind of stressors do you think that put on those individuals?
Well, certainly they have the ongoing and constant stressor of potentially being exposed to the virus, and wondering if they'll get sick, and wondering if they might come home and get their family members sick. It's similar to what you were saying about you and your wife feeling like you weren't sure if you could have, physically touch your kids. And so, I've certainly read a lot about healthcare workers undressing before they come in the house and then showering right away, and just really worrying if they're bringing the virus home, maybe to like an elder person in their household who has some underlying conditions, or children who have anyone can have an underlying condition, and just really worried about what their professional responsibilities mean for them and their family. And also, a lot of healthcare providers are now facing cuts in their pay because the cancellation of all of the elective surgeries and treatments has meant a huge loss of revenue in our local healthcare system. And so it's a double blow of being asked to work in these in a vulnerable situation and also receiving a pay cut. I mean, that must be really demoralizing, and it makes me worry for their mental health. And I also think that just that feeling of vulnerability, we are all feeling that. But if you're on the front lines in grocery stores and healthcare as a first responder, then you are probably feeling really vulnerable. I want to segue though, Jason, because that gives me an opportunity to talk too about how those frontline workers are also able to engage something that really builds resilience and positivity, which is making meaning out of a difficult or traumatic event. So we know that people come out better, more psychologically healthy, if they can make meaning from a very stressful or traumatic event. And so the silver lining for healthcare providers, hopefully, is that they really are doing meaningful work. And for grocery store workers and first responders, all essential workers are doing very meaningful work right now. And that will make them more resilient to any longer term mental health impact. And I really want to encourage everyone out there, whether you're an essential worker or not, to figure out how you can make meaning out of this experience, whether it's helping others, contributing to your community, or doing things like making art or appreciating art. So, or enjoying cooking or getting out into nature. There are a lot of things we can do right now that are meaningful.
Yeah, I love that. I think one thing, hopefully, that this has given people, there's a couple things, is perspective. If you're frustrated, and obviously nobody wants this situation. The governments don't want to close businesses. People want to be able to go places that they are used to going. We all want to be able to do that. No one wants this. However, the perspective is, if people are asking you to stay at home more, or respect the social distancing, change your lives a little bit, it's a lot different, not necessarily something to be so concerned about, versus being one of those frontline workers that has to basically continually possibly be exposed to this thing over and over again. So a little perspective there. And then the other part is an appreciation, I think. In general, I think we appreciate our medical professionals pretty well, things like that. Maybe not enough, but when was the last time you thanked someone at the grocery store for what they do? You should now, if you haven't been. Sorry, I'm throwing my opinion in there again, but that's the way I feel.
Well, and that's a great example of making meaning, is expressing gratitude to those who are taking risks right now. So I think it's a great suggestion. And I think I'd like to make some other recommendations too in terms of coping right now, Jason. There are a lot of things that we can try, like getting outside and exercising. I've been recommending to a lot of people to try to switch it up in terms of where you go, because right now our senses are so understimulated. We're seeing and hearing like the same things over and over again. And so it's nice to go somewhere different, maybe a neighborhood or a park you've never been before, and just see some new stimulation and smell and hear some new things. And people are really responding well to that suggestion. So I hope people will try it out. Also, think about what helps you feel connected to others, and be sure to engage in those types of connection. A lot of people are telling me they're having trouble with motivation. It's just hard to do the things that you plan to do or want to do or need to do. And I really think our expectations for ourselves right now need to we need to have compassion for ourselves that just getting through each day right now takes an extra amount of energy and focus. And so our to-do list should be shorter these days, and we should have compassion for ourselves in terms of what we can motivate to do, and just give ourselves a pat on the back for what we can get done.
That was one of the things I was going to ask you next about some of the strategies, some of the ways we can try to improve things for ourselves, get through this time, and what we can do moving forward. And I love all of that. I think when you have a situation where we're doing all of these things that are so different, and you're right, I think we need to be a little kinder to ourselves, a little bit, not overindulge ourselves where we're completely getting away from, we're not back in college life or something when we have very few responsibilities outside of school or whatever, however your college life was. Some of us had different experience. But anyway, the point being, I've heard people tell me about this, Elizabeth. I've heard people talk about the importance of getting back into and keeping some sort of routine. How important is that to our mental health?
Yeah, thanks for mentioning that. It's really important to try to go to bed and wake up around the same time every day, to eat regular meals throughout the day, and to have routine for adults and for children is really helpful, because right now there's so much unpredictability. So it's really helpful and reassuring to have predictability. And you might even institute some new rituals or practices in your family, or for yourself, or for a pet, or for a connection. Maybe you'll reestablish like a Sunday night call with a family member, like people used to do back in the day when Sundays were the cheapest phone call time.
Right.
So we can establish new rituals and traditions. I know some parents are teaching grandchildren through the use of technology, and everyone wins when that happens. So we can be creative in terms of coming up with traditions and a regular schedule to help keep us feel like some things in life are predictable and stable right now. That's really important.
Yeah, one thing we've started is because my family, whenever we got together for big family gatherings, my brother, my sister, my parents, and their families, we always played games. And so it's a little tricky in this format, but there are certainly some games that you can connect using video conferencing, using Zoom or other places, Messenger, Facebook video, stuff like that, where you can then still play some games. And you can start with some simple ones like charades or Pictionary or different things like that. And then there's some other board games or things like that you can get into. But I mean, that's done. It's connected our family back, because like you said, we would have gotten together for a birthday this month. There's some other things we would have seen each other, and that's what we would have been doing. So we've taken Saturdays at 4:00 is family game time. Let's hop on and do it.
That's terrific. That's a great adjustment and way to be flexible during this time. And flexibility is key right now. I really like that.
Any other things you know of out there that are there strategies or things people are doing or you would suggest doing to kind of give us a little bit more sense of normalcy, take us away from just the news or being just kind of inundated or obsessed with this current health crisis?
Yeah, so Jason, that's a good point, that we should try not to check the news and check our devices all day long. It's very stressful. And what I noticed is in the beginning of all of this, it really was important to stay on top of the information, because it had a direct and immediate impact on all of us. Schools were closing, and then we had the safer at home instructions, and a lot of changes were happening very quickly, and we got used to having to stay on top of it. Now the information is not coming in as quickly, so I think it's important for us to stay on top of the news a couple times a day, but not all day long. That's a good point.
Yeah, I found that too. I mean, right now, by now, we kind of know what the situation is. We are pretty well versed, if you've been paying attention to what's happening and what we need to do to keep ourselves safe and be respectful of others and help do our part in this. And so, continually watching every single briefing or news story or whatever not the greatest idea, especially if that's what you're doing all day, between your phone and the computer and the TV and whatever.
Right. That really makes the anxiety go up. And, I think a lot of what experts are saying right now is we need to give ourselves a break in terms of trying to minimize screen time in general. That, screens are there for entertainment too. And I really suggest that people watch whatever they like that is a distraction and that is entertaining, but certainly comedy, things that are funny, are a great distraction these days.
Is there any, and just kind of a side comment here or something I was wondering about, question, but is there any mental relationship to having a small device like a phone and being on that for such a long period of time versus when you're further away from it, like watching something on television?
I don't know of any research that has looked at the difference in size of devices or the difference across devices. I don't know if we're far enough along in that research, but I might suggest, for example, that if you do live with other people or with pets, that watching a larger device like a TV or even an iPad is a more communal event. And so if you feel more connected with others, then that is better for you psychologically than if you're just alone with your phone. You're disconnected physically. I guess you might feel connected through the phone, but it's again that touch, that sort of being close to others or to pets, that really pays off psychologically.
Oh, okay. I just personally, I've experienced just kind of, if I'm on my phone too long, I just start, I feel more tense. I feel more anxiety after being on it for too long. And I don't necessarily feel that same way if I sit down and watch a 3-hour movie. So I wondered if there was anything to that.
Yeah, well, I think it has to do with what I was describing. And I also really want to encourage you and everyone to pay attention to their own personal reactions. We don't have to have research to support your own experience. And again, have that compassion for yourself and to respond to what you need in that moment, which is to get off your phone.
Elizabeth, is there anything else out there that we should mention? I'm going to check Facebook here, see if we have any things that we need to address, but anything you can share with the group at this point?
Well, I just want to encourage everyone to keep using the coping strategies that are working and to try to not use the coping strategies that aren't working, to stay as physically and mentally healthy as possible, and to know that this is time limited. This too shall pass, and we can get through this hard thing just like we've gotten through other hard things.
I appreciate all of your insight today, and finishing up with a nice positive comment that hopefully can help us kind of propel us a little bit through here. But I know you had information, ways that people might be able to reach out if they are looking for either some assistance or maybe looking into your services. Could you give us those quick? We'll include them in the post afterwards.
Sure, thanks. So I'm Dr. Elizabeth Winston. I'm a licensed counseling psychologist at Shorewood Psychology, and you can find me at our website, shorewoodpsychology.com. And I'm also a psychologically informed organizational consultant with the Business Consulting Collaborative, and you can find me there at consultingcollaborative.org.
One quick thing before we go, I'm wearing my blue for the last Friday of the month. For Child Abuse and Neglect Month awareness. So wear your blue today if you can. Elizabeth, thanks so much for taking time to talk to us. We appreciate all of your insight and what you're doing to help people during this time.
Thank you. Thanks for having me. Good luck out there, everybody. Bye.
All right. Take care, everyone. We'll catch you again soon. Be safe and stay well.